the public administration and safety was the highest proportion of workers experiencing stress after transport, postal and warehousing. I was once a public servant. I was the Director of Mental Health in DHHS in Victoria for 5 years. And the challenge, I think, is about understanding what the public's expecting and being able to plan a response in a considered way. And I think one of the challenges here was the tight timeframes and the need to act quickly. But that comes as a cost, yeah? And I think that as with many situations where people are challenged or anxious, they're going to look for the difficult areas or look for the problems or look for where things have gone wrong and not always recognise where things have gone right. And you said it yourself, Chris, respecting that Australia's done an amazing job compared to the rest of the world. There are still instances where things haven't gone as well as they could have. And the community expectations when people are anxious are that they will be cared for and the government will look after them and through the public sector. And the expectations are always very high the more anxious people become. I think when there isn't good communication, Chris, from leaders about why things are happening, you're left to try and understand that yourself. You know, why are we doing this? What's behind what we're doing? Why is it important? How does it fit with our values as an organisation and as a public sector in terms of responding to, you know, both our prescribed role and the expectations of the community? And when those links are made and people understand them explicitly and can buy into them, if you like, or sign up to them, you can feel like you're more engaged with the change and you have some agency yourself rather than having it done to you. We know from workplace research in the past that the more agency you have yourself, the more positive you are about your work and about your own contribution to it. Signs to look out for are things like people who are becoming less social, more withdrawn, making simple mistakes, missing in action, if you like, when you expected to see them and they're not there, making statements that provide hints that they're not really doing well. They're unable to switch off and they're telling you that sleep is disrupted and those sorts of things. And we know that a formal diagnosis of post-traumatic stress disorder has, those sorts of things in spades. That doesn't mean that they can't be working. In fact, many people work with and live with and work with really challenging stress in their lives. I guess the important piece is about, how it affects their work on a day-to-day basis and what support can be provided in a workplace context and when it might need to be followed up in a private context. When you've worked with someone for a while in a team, you can tell when things have changed and you can say to them, is everything all right? Is everything okay? The stronger teams are the ones where they already have those conversations and that trust exists between workers and their managers and leaders around how they're coping and how they're feeling. And I guess for leaders, the challenge is about building that trust and ensuring that there is a safe, confiding space to talk about those sorts of issues.